going to begin. Thanks. Thanks for coming. Thanks for joining us here today. The reason why we wanted to wait, because it's important, because the agreement we've been able to reach, standing on our principle of protecting the sanctity of life in healthcare reform, could not have been done without the support of the colleagues with me today and our West Virginia colleagues, Mr. Rahal, Mr. Mollahan. So I'm pleased to announce that we have an agreement, and it's with the help of the President, the Speaker, we were able to come with an agreement to protect the sanctity of life in the healthcare reform, that there will be no public funding for abortion in this legislation. We've all stood on principle. It's a principle we've carried forward ever since June 25th, when we first signed a letter to the Speaker saying, as we do healthcare reform, we do not want any public funding for abortion. We expect the current Hyde language to apply throughout this healthcare bill. We've always said, most of us at least, that we were for healthcare reform. We wanted to see healthcare reform, but there was a principle that meant more to us than anything, and that was the sanctity of life, that you have to continue with that moral principle of protecting those unborn children. So I've always supported healthcare reform. We demanded the current law be there, that the sacred promise be kept, and I'm pleased to say we have. Today, the President has announced he will be signing an executive order. That executive order will be signed after the health care legislation, as it refers back to the health care legislation, to reinforce that principle, that belief that we all stood on, no public funding for abortion. There's been some question raised by different groups that in this health care reform package, that somehow, some way, the abortions could be performed at the community health centers. The President's executive order makes it very clear that will not happen. There's some question that underneath in this bill that somehow you could pay for abortions with the new funds being appropriated for the community health centers. That is not possible with this executive order. There was concerns in this legislation that the conscience clause, that those who might have religious or moral objections, or a facility run by, say, the Catholic Health Association, would somehow be co-opted or their values be lessened underneath this health care legislation. The President makes it very clear the conscience clause will always be available and it will be in force of law. But all of that, the real victory here, or the real winner, is really the American people.